Good morning. It is just about 6:42 today. We've talked about the surge in the need for mental health services during the pandemic, but many psychologists are just overwhelmed with new patients. So here to give us some insight into this industry is the mental health counselor. We have Mindy Cardeline joining us right now. Good morning, Mindy. How are you?
Good morning. I'm doing well, Krista. How are you?
Great. It's great to talk to you, especially about this issue that we're seeing. So can you tell me, give us some insight, are we seeing a higher demand for mental health care right now?
Yeah, so our agency, we've experienced a big influx of new clients coming in. A lot of it's the stress with the pandemic. A lot of people are going through a lot the past year. There's a lot of grief that's happening, not only grieving losing loved ones, but we're also grieving a lot of the things that we missed out on because of the pandemic. So plans, weddings, graduations. So a lot of people are coming in wanting to know how to deal with all of that stress, anxiety, depression that's coming up.
Yeah, I mean, when I'm thinking of it, like comparing it to a store, you know, when you have a lot of customers come in and you only have so many cashiers, kind of what's the impact when you have so many new clients and we still have the same amount of mental health care professionals?
Sure. So yeah, it does put a little bit of a strain. So we do our best to fill in as much as we can. Our office is actually opening a new office in Canfield. So we're going to be able to have new clinicians. So we're going to be able to serve our community in a lot better space.
So I guess give me your opinion. Do you think that this is a good thing or a bad thing? You know, that we have people seeking help, but there's the need for help too. What do you think?
I think it's great that people are reaching out and definitely getting help. I think since everybody's going through a lot of stress right now, it's kind of normalized seeking help. The ability to use telehealth has really helped a lot of people who might not have had access to mental health care in the past. So I think that that's another added bonus with everything that's kind of going on, that we're able to provide those services now as well.
Yeah. Tell me a little bit about the stigma with mental health care too. And have you seen that evolve and change throughout the pandemic?
Sure. So, like I said, I think a lot more people are comfortable with reaching out for help right now because it is a little bit more normalized that everybody's going through a lot of stress. But there is still a lot of stigma. Certain populations have a much more difficult time reaching out and wanting help. There's a lot of that idea that, seeking help is weakness, or, that we can't ask for help or no one's going to be able to understand. So there is still that stigma there. But I would say definitely a lot more people are reaching out and kind of trying to break out of that stigma.
Yeah, and what kind of population are you seeing seeking out mental health treatment?
Yeah, so our office, we serve children, adolescents, adults, couples. So we're seeing an influx in all of those areas. A lot of kids are struggling right now with school. So we're seeing a little bit more kids coming in, kind of trying to deal with the stress of navigating everything that has changed with school, with the pandemic. Like I said, we also work with adults, couples. So we see a little bit of everybody.
Yeah, and I know, Mindy, so many people have this sense of hope, right? A lot of people are getting vaccines right now. Is it important to continue that mental health care, after this too, and kind of process this past year for us?
Absolutely. So, why get rid of what's working? So, if we're starting to notice that we are doing a lot better, we might taper back on how often, we're being seen or how often we're going to see a counselor. But it's really important to make sure that we're continuing to use what works. A lot of times we get that sense of hope. I think all of us, when 2021 came, we were expecting, a lot of change happening, and it is happening, and that's really good. But we still need to monitor our expectations.
Yeah, and I know if people do want to get an appointment, it is good to get in soon, right, and get on the calendar. So tell me how we can get in contact with you, and really, how soon in advance do we need to make an appointment nowadays?
Sure. So we want to try to call as soon as you can. We always keep a cancellation list, so even if you are waiting a little bit to get in, we always try to get people in as soon as possible. But you can reach our agency, Advanced Counseling Solutions, at 330-707-4433.
Mindy, you're the best. Always a pleasure to see you. I hope you have a wonderful Easter season if you're celebrating, okay?
You too, Krista, and good luck.
Oh, thank you. I'm going to miss her, Mindy. Maybe I'll start wearing glasses. I can't wear them on air because of the reflection, but I'll bring a little Mindy with me. After TV
Yeah.
News Life. Thank you, Mindy. Alrighty, it is about that time of the day.